A ransomware attack in a hospital is not just an IT issue. It can shut down EHR access, delay appointments, disrupt billing, affect pharmacy workflows, and force clinical teams into downtime procedures. In 2024, the Change Healthcare cyber attack impacted hospitals across the U.S. An American Hospital Association survey found that 74% of hospitals reported direct patient care impact, and 94% reported financial impact. That is why ransomware readiness for hospitals, segmentation, backup, and DR matters. This course helps you understand ransomware risks, network segmentation, backup planning, disaster recovery, downtime workflows, incident response, communication planning, and recovery priorities for EHR and clinical systems. Inside the course, you get practical lessons, hospital-based scenarios, ransomware readiness checklists, backup and recovery planning tools, downloadable study materials, and clear guidance for protecting EHR and clinical systems. After completion, you receive a certificate, free reference resources, and support materials you can use to strengthen your hospital's cyber readiness. Because ransomware readiness is not just about getting systems back online. It is about protecting patient records, reducing downtime, supporting clinical teams, and keeping care moving when every minute matters.